Welcome to Why Health, a podcast brought to you by the BYU Public Health Department. I'm Dr. Cougar Hall, a professor here at Brigham Young University. Whether you are a student, parent, or BYU fan, this podcast will help you navigate the world of public health. Our podcast strives to help individuals receive accurate information regarding public health. So whether it's global or local, we will discuss how it pertains to you. Just kick back and relax as we talk about why health. It's my pleasure to welcome my colleague and friend, Dr. Lori Spruance, onto the Why Health podcast. How you doing, Lori?
I'm great. Thanks for having me today.
Well, thanks for joining us. I probably owe you lunch or something here for taking your time this morning. I really appreciate it.
Yeah.
Will you, for our listeners, introduce yourself, including your educational background and what you do here at BYU?
Absolutely. So I grew up in Boise, Idaho, originally, and went to Utah State for my undergrad. Considered coming to BYU, but at the time, my sister, who I was close with, was at Utah State, and I just was drawn to be an Aggie. My first year on campus, I had 11 cousins that were on campus with me, so it was really fun to be there with family members. I knew originally I wanted to go into teaching as a physical education teacher. I feel like oftentimes as high school students we're drawn to major in the things that we know we're talented at, and I was a talented athlete and thought that that's where I wanted to spend my time. And during my time at Utah State, I was required in one of my physical education classes to write a paper about some sort of emerging topic. I don't even remember, but I selected to study childhood obesity for this 2 or 3 page paper. And I remember being very surprised at all of the chronic diseases associated with physical inactivity and nutrition. And of course, it probably doesn't sound that earth-shattering now, but as a 18-year-old, a 19-year-old, it was really surprising to me that I was thinking about all of these preventable diseases that if we could get people to eat healthier or be more physically active, could have a much better quality of life. So that really set me on the trajectory of public health. I didn't know it at the time that this was public health, but I spent time, studying and preparing to be a junior high or a high school teacher, or maybe even an elementary teacher for physical education. At the time at Utah State, we were required to, as teaching majors, to have either a minor or a second major. So I was a physical education major, and then had to declare some other minor or major. And I spent a lot of time thinking about, would I add history to that? Would I add English? What would I do? And I ended up deciding to land on school health, which seems like the obvious choice, but I just really then got drawn to the whole concept of health other than just physical education. And so that's what really led me to my master's degree, was I wanted to focus on community skills. And I didn't feel like I had any community skills to address health issues.
Right.
So I did my master's at UNLV in Las Vegas in a program called a Master of Education in Health Promotion. It's not a degree that really exists anymore. Most of those programs have been more or less absorbed by MPH programs, Master of Public Health programs. But that's where I kind of found my people. I took a lot of the same classes as Master of Public Health students, and I was like, this is what fascinates me. I did my Ph.D. at Tulane University at the School of Public Health and Tropical Medicine in New Orleans, and spent 4 years there. Kind of brought me full circle. My dissertation was on school-based salad bars, so I thought, this is really cool. I can combine research with my original interest of school health and wrap it all into one career.
Very cool.
So it took me a long time to kind of put all that together, but I love that I had this passion when I was 18, 19 about schools and kids, and now I still am exploring that passion through my research and trying to come up with evidence-based practices on how to improve health for kids K through 12.
So refreshing. I think my background is also school health education, and sometimes we feel like there's this artificial divide between public health and school health. I don't know why. I think I see schools as another setting and students as another population, and we're promoting health. And the cool thing about using students in schools, they're young, they're still impressionable. You have broad exposure because most students are in schools, and it just makes sense to me. So you are my people. We have met up. There's all sorts of reasons why you and I are here together talking this morning, and that connects us for sure.
Absolutely.
Yeah. I love your passion across the board. You are one of our best instructors. You're one of our most prolific researchers. And congratulations, by the way. Maybe our audience doesn't know this, but you recently obtained the BYU version of tenure,
Thank you.
which we call CFS, or continuing faculty status. And that is quite a hurdle. And so congratulations to you, Lori.
Thank you so much.
I am so thankful that you are in the hallway here and that we're colleagues. Tell me about some of the research that really is of interest to you right now. What are you doing right now with your research time and your research efforts?
Yeah, so one thing that's been real popular in the last couple of years because of COVID is exploring this idea of we call either universal school meals or healthy school meals for all. And the concept behind that is that for the last 2 years, the federal government has waived the requirements to qualify for free meals through the schools because of pandemic issues. They were like, let's just make school meals free for everyone, regardless of their income status. And so that's something that I've been exploring recently, too, is with the idea that these waivers are going away. In fact, they're going away in September. That the next academic year, school meals will no longer be free for kids. And so that's been something that I've been exploring is what are the benefits of those? Are lawmakers on board with considering continuing to make them free for kids? How many kids have begun participating in school meals because they've been free for every child? And I know there's a lot of sometimes concerns about just providing stuff free for everyone. Well, where's the self-reliance? Or, is that the best way of reaching everyone? That sort of thing. But it's been really fascinating to me to think about, well, kids, we should care a lot about kids. And, of all things to provide for, I think feeding kids is probably not the worst thing we could consider doing. But just also kind of exploring some of those perspectives. But one of the things that really is near and dear to me is the idea of reducing stigma for kids. You don't want to be the poor kid who is getting your meals for free at school, or, all your other peers to know that you come from a background that's not as privileged as someone else. So that's one thing I really like about the concept of universal meals or free meals is that it eliminates a lot of stigma for kids who need to participate in these meals and may face stigma relative to it. Another cool thing about school meals that I've spent a lot of time thinking and researching and advocating for, so to speak, is the healthfulness of school meals. And I have a lot of conversations with parents, with other folks who are invested in child nutrition, so to speak, is that there's oftentimes a big stigma around school meals. And I'm not saying that there's no room to improve school meals. I absolutely think that there's place to do that. But sometimes we get caught up between the difference between appeal and nutrition. And sometimes nutritious foods are appealing. And sometimes appealing foods are not nutritious. And the school's mission really is to provide nutritious meals. And the research, by and large, says kids who eat meals at school have more nutritious diets than kids who bring food or eat food from any other location. I think that's surprising to a lot of people because they think, well, I do a good job packing my own kids' lunch, or they're in charge of packing it and they're supposed to have a fruit and a vegetable and that sort of thing. But I always try and reiterate that, we try our best to make healthy choices in our home too, but we certainly don't have nutrition requirements in the home. That if my husband brings home a loaf of white bread, I don't chuck it out and say, well, it's not 50% or more whole grain, so we can't eat it. So I think that that's something that's really important to consider is that meals kids get at home or at school are, the research says over and over again, are healthier than any other place that they could get food.
I love that perspective. I'm not near as knowledgeable as you, Lori. I have done a little work in this space, and primarily before I came to BYU, when I worked in the public schools and tried with some vigor to remove vending machines. And it wasn't because I wanted to limit the students' freedom, because just of how detrimental that was to the federally funded school lunch program and to learning.
Yes.
So I think we're concerned about a student's health, physiological, biological, like their health, But also, there is this very strong connection between a student's health and their academic outcomes. The healthy student is the better student academically as well. And so even if there's a parent out there who's not all that concerned about, high fructose corn syrup, or there's added sugars, or whatever it is, that's just not their thing. I don't know a parent who's not concerned about their child's learning. So to make that connection. And this is where I think public health really there's this mesh point with policy. And again, you're in this space working, but it's not just the content, but it's also the timing of lunches. We find that students, if recess is directly after lunch, they want so bad to get to the monkey bars. They want so bad to play, soccer out on, and they just throw the lunch away and get out. There's so many things that we can do as we have good data that can inform good policy. We can tinker, and we can certainly invest better in children and both academic and health outcomes. What is your perspective? Because you and I, about a year ago, we were asked to be a part of a diversity, inclusion, and belonging. And it was a little bit of an ad hoc. It's like, the university is starting to really dial in on this. We had a campus-wide survey. And we thought, well, we want to know what's going on with our students. What's happening with the students that are majoring in public health? And so we created a survey. It was similar, but also diverged a little bit from what the whole campus, climate survey did. Tell me about that process. Tell me, where do your concerns related to diversity, inclusion, belonging, where do they come from? What makes you such a strong advocate for BYU students?
Yeah, absolutely. First of all, I think the roots of my advocacy for students come from a variety of different places, some of them before I have even became a faculty member here at BYU. But one of the first experiences I remember here as a faculty member is I had a student of color approach me in my office, and she expressed that she felt she experienced racism in my class. And that was like a dagger to the heart, because I feel like I try and create a safe place for students.
Sure.
But some of those students still weren't experiencing safety. And so her and I had a long conversation about, well, what do you feel you experience, and can you give me some examples? And not that I was trying to interrogate her or in any way, but I just needed to know or understand. And that became a realization to me that when I think it's a safe place, that doesn't mean everyone in the classroom feels it's a safe place. And it always kind of brings me back to what we learn from, as an example from Christ, that he reached out to the one who was suffering. He didn't look at the 99 and say, well, 99% of people are fine. Like, we want to give ourselves a big thumbs up because, 99% is pretty good. He spent his time learning and reaching out to those folks who were struggling. So that's where a lot of my advocacy comes from, is thinking about those students who aren't having a positive experience here at BYU. And while many students are, there's many who feel isolated, who don't feel like they belong here for a variety of reasons, not just because of race, but it could be because of where they're at in their testimony, or if they're part of the LGBTQ community, so many different reasons. And so that really has inspired me to try and continually work to make our department, my classroom spaces, a place where people can express if they're struggling, that they can hopefully come to me if they need some support, and of course continue to be an advocate on how can we make our department better.
Love it. Let me ask a question about this. I know that there's some degree of criticism of professors who really are taking that approach, wanting to be more inclusive. There's some criticism from those on the outside primarily looking in saying, so what's going on? Is BYU all about identity politics and intersectionality? In other words, we have this gospel perspective that we're all brothers and sisters. It's very much a common humanity. And yet there are certainly cultural currents that are saying, well, no, we're not one big happy family. There are many of us who feel like we're on the outside looking in and have historically been oppressed or been marginalized. And so I think there are folks that are criticizing some efforts at BYU, saying, you guys have gotten away from this common humanity. We're all brothers and sisters. And rather than focus on our similarities, you want to point out the differences. And rather than be hopeful and inspiring, we're actually creating victims. And you're going to feel, oh, let me show you how, oh, you're a person of color. Oh, and you're a female. Oh, and look at all of these intersections where you've been oppressed. And I personally haven't sensed that at BYU. I've actually sensed what you described. But let me just allow you to speak to that. Where do you balance belonging and inclusion and reaching out to the one and trying to really instill hope across the board and point people to Christ?
Well, I think a lot of this to me is rooted in what I have read Christ does. That's where he would want us to spend our time, is with the marginalized communities.
The foundation of public health truly is social justice. It truly is concerned about the burdens and the benefits of society, how they're distributed. And whether it's looking for equal opportunities, I think is the version that we've adopted in our department, as far as we want equal opportunities for all, or whether it's a little bit more of equal outcomes for all. There's probably some tug of war between those objectives in public health and social justice. But tell us how you navigate that space and how you feel we're doing in our department.
So first, I think conversations have to continue to happen, and I think that despite maybe some of the political climate surrounding all of this, it's easy to try and shy away from those. I want to shy away from them sometimes because it's like, I don't want to be on some clip on the internet or, my words taken out of context. But I have to remind myself that if I don't have these critical conversations, I'm doing a disservice to my students. So a lot of the conversation that in any of my classes that surround this sort of thing really comes in one of my master's classes, where we focus on community building and organizing. And one of the key skills in public health that I'm trying to reiterate is that communities frequently know what's best for them. They may have fewer access to resources or may not have political power to advocate for themselves, that sort of thing. But we're rarely going into communities and saying, I have the solution for you, listen to me. We might have some of the key skill sets in order to help them reach the outcomes that they desire. But part of that requires being able to listen to community members. And if we don't have the skills to be able to listen to them, then we really are doing a disservice to the communities themselves. So a lot of the skills that I'm trying to build with my students is how to help them listen to community members and recognize that sometimes they come into a community space with privilege and power that the community members themselves don't have access to. And so we really should be approaching problems in public health as not, I'm the public health person in charge or responsible for solving the problems, but I may have more knowledge and more privilege or power than you do as a community member. So let's work together to solve the problems. And I think oftentimes as young adults, we come in not being cognizant of some of the privilege we had. I certainly was that way. In fact, it took me a long time to recognize that I might have any privilege, because I often just attributed it to, well, I'm a hard worker, and not to discourage or take away from the fact that many of us are hard workers, but sometimes it's just easier to get things done because of certain privileges that you had. So I really try and instill critical thinking in my students. One thing that we do in this particular class is I have them think about a health disparity on a certain characteristic. It could be from race or gender or sexuality. And I say, okay, there are differences in maternal mortality outcomes between blacks and whites. Start thinking about the root causes. So what are the root causes that cause that? And maybe it's an education level. Okay, well, why is there a difference in education level? Well, maybe there's different access to schools that they grew up in. Well, why are there different access to types of schools that you grow up in? Well, because of money and the community you live in. Well, but why? And I just really keep making them ask the question why. So we don't just say, oh, well, it's an education issue. Well, so where can we potentially resolve that difference so that the upstream or the downstream consequence will be that we have better maternal outcome rates? And it could be any sort of public health issue. Almost every single public health issue has some sort of disparity, either by gender, by race, by sexuality. We see so many differences. So I really try and get students to think deeply about what those root causes are. And oftentimes it comes back to societal structures. And I know that's not necessarily the popular opinion sometimes, but it's like, because of redlining in the past where individuals couldn't get access to certain home loans. They were then in a more impoverished community. And these are things that have gone on for generations, but that are still having long-term outcomes today. So we need to think about how can we address the upstream root cause so that we can address some of these health outcomes. And of course, it's super challenging. But that's the work we need to be doing as public health folks.
I sometimes have students, and actually some other relationships I have outside the university, where people will criticize me and say, you just want to talk about the social determinants, and you're completely removing individual responsibility and agency, and those are foundational truths. And I say, no, we're not actually. We believe in the individual determinants of health as well. We do believe that we have agency. We're agents unto ourselves. Understand that this is the profession. The profession is called public health. So our purview is populations. If you want to talk about an individual, you can go to exercise and wellness because that's what they do. They talk about working with individuals. You can go to many aspects of healthcare, where it's a practitioner and a patient one-on-one. And they're talking about those individual determinants. They're talking about individual behavior change and decision-making. And that's great. We don't disagree with that. What we're saying is there are also overlaying social determinants. And we're all about populations and we're about prevention. And if we can provide good data, and that data can lead to better policies that help those communities that have traditionally been impacted by things like racism, and we can move forward. That's the low-hanging fruit. We've just improved outcomes for an entire community. And it just seems that many people fall into this all-or-nothing thinking where it's like, oh, if you're talking about social determinants, you don't think there's any individual accountability. Oh, no, on the contrary. And if you're talking about individual determinants, then you don't think that there's societal-wide issues that lead to these disparities? No, I think everyone would say, yeah, absolutely. So it just feels like we get kind of siloed in our thinking. Most of the challenges we have, if not all, they're far more nuanced. I just think we're in a time period where it's just sound bites, it's hashtags, and to understand that communities and society, it's much more nuanced. It's much messier than many people want to admit and want to discuss. I really appreciate the balance that you have in really asking those hard questions. There's a difference, I think, between teaching students what to think and teaching them how to think. And when you're following up with a student response saying, why? And why? You're not telling them why. You're asking them, I need you to think more critically. I need you to take all the information you know and really get a little deeper. Why are we seeing this phenomenon? What's going on? What's going on at the community level? That for me is education. And
yeah,
so
for sure.
I just love it.
Students arrive at what I would arrive to, and I make them draw out this assignment, that sort of thing. And sometimes I'm like, that's exactly what I would have come to. Sometimes it's not, and that's okay. Both solutions to the but why question are important. And yeah, I want them to come up with it and be able to think through the but why question. So I'm all for whatever they arrive at, and sometimes they're similar to mine and sometimes they're not. I wanted to add one other thing that I was thinking about as you were talking about individual choice, is this idea that we can't have individual choice if there's not an environment that supports individual choice. So a lot of this for me, especially in the nutrition angle, came when I lived in New Orleans. And of course, there's some very impoverished communities in New Orleans. And some of the faculty that I work with did some grocery store studies to look at the types of foods that are offered in different grocery or corner store, convenience store locations across the community. And there were certain communities that the only access to grocery stores or corner stores. And you'd walk in those corner stores and they're really what you would imagine, candy, alcohol, chips, those sorts of items. And sometimes if they had fresh fruits or vegetables, they'd be, brown bananas or soggy apples. I'm trying to think of some of the examples. And if we are trying to tell individuals, make the healthy choice, they're like, well, in order to do that, I'd have to take a bus 15 miles across town. And that is a huge barrier, to shop at a house. So if there's not a place for them to access healthy foods, then how are they going to make the healthy choice? And so, this might be a silly parallel, but it got me thinking a little bit about gospel things as well, is that we believe in the restored gospel that if someone didn't have access to the truth, that they won't be held accountable the same way as someone who had access to the truth. And I'm like, it's kind of the same thing. You can't choose the gospel of Jesus Christ if you never heard about it. You can't choose the healthy item if you don't have access to it. And I know those are kind of silly parallels, but oftentimes that's really the gospel of Jesus Christ is what informs my thinking of the world. And I think, yes, individuals need to choose. But if you don't have a choice, there's not a choice to be made.
I don't find that to be a silly parallel at all. In fact, when I try to describe what public health is for a friend who only has 10 seconds to listen, I say public health is making the healthy choice the easy choice. It really comes back to opportunity. And almost everyone I know would agree with, we should have equal opportunity. Now, once you have those opportunities, it's hard to guarantee equal outcomes, right? Because we're going to make individual decisions and choices. But that's what public health is trying to do. It's trying to grease the skids a little so that the healthy choice becomes more of a default setting. It's easier to select the healthy option. It's easier for me to wake up and go for a walk or go for a run because I have a safe place in which to do that. And I don't think that's silly at all. I think you've nailed it, actually. Those opportunities, that's what we're about. I love it. Okay, I've taken a lot of your time. I could talk to you all day, Lori. I really could. I just love these conversations. What are you reading right now that's inspiring you? That's just really charging your batteries?
Yeah, so I am reading a book by Nyla McBain. She's a historian, researcher here in the state of Utah, actually. It's called Pioneering the Vote. And her book is all about looking at the history regarding women's suffrage and the Mormon pioneers. Cool. And how really women of the church at that time were on the forefront of advocating for women's rights. And I find that really inspiring that our early women leaders within the church had such great insight to know that it was so important for women to have access to education, to have access to vote, those sorts of things. So I'm reading and learning all about the origins of the women's suffrage movement, that a lot of it, I wouldn't say started in Utah, but a lot of the individuals, members of the church in Utah, were huge advocates for women voting rights. So I've been learning a lot about that, and I've just been really inspired by the faith and the testimony and the advocacy of these women, and trying to embody some of the things that they stood for in my own life. And yeah, that's what's inspiring my reading right now.
I love it. I need to add that to my list. It really is like we had some very strong actors in that first wave of feminism.
Huge.
Remarkable.
And being the first state to grant the right, we weren't the first state to grant the right for women to vote, but we were the first state that women had the opportunity to exercise the privilege of voting, and it's been fascinating. So yeah, add it to your list. It's not a terribly long book, but it's, again, inspiring to think about the impact these women had on the country.
I love it. Thanks for sharing that. And again, you are an inspiration. So thankful that you're a colleague and that students at BYU get to learn from and discuss these important issues with you. Thanks, Lori, for sharing your time with us this morning, and all the best.
Of course, such a privilege.
Thank you for joining us today. Catch us on our next episode, and don't forget to subscribe to future Why Health episodes.